Welcome to our presentation on food allergies and intolerances. In this presentation, we will be discussing the differences between allergies and intolerances, the most common foods, treatment plans, and why this is so important to understand. First, food allergies are characterized by immune response to protein in food. The body's immune system goes into defense mode and begins fighting off the offending proteins it considers harmful. Foods that are known to cause allergic reactions are called allergens. The major allergens in the U.S. are milk, eggs, peanuts, tree nuts, soy, wheat, fish, and shellfish, and are commonly referred to as the Big Eight. These allergens and many others can lead to symptoms such as itching, burning, and swelling around the mouth, swelling of face or eyes, runny nose, skin rash, hives, diarrhea, abdominal cramps, breathing difficulties including wheezing and asthma, vomiting, nausea, and some allergic reactions can lead to anaphylaxis, which is a severe allergic response and can even lead to death. Food allergies affect about 4% of children and 5% of adults in the United States, but it may be on the rise as many studies have suggested a true rise in prevalence over the past 10 to 20 years. More than 170 foods have been found to cause allergic reactions, but most studies focus on the Big Eight. Seafood allergies, according to a Swedish study, were found to vary in prevalence. With fish allergies, 0.2% of children and 0.5% of adults had the allergy. With crustacean shellfish allergies, it was 0.5% versus 2.5%. And with any seafood allergy, it was around 0.6% versus 2.8%. The rates were also found to be higher for women than men, with shellfish allergies being at 2.6% versus 1.5%, and any fish allergy being at 0.6% versus 0.2%. Milk and egg allergies, according to a Danish study, found that in a group of children polled 6.7%, or 117 children, were suspected of having a milk allergy, and it was confirmed in 2.2%, or 39 children. When it comes to peanuts, the prevalence in the United States reports about 0.6% of the population, and the prevalence in France, Germany, Israel, Sweden, and the United Kingdom varies between 0.06% and 5.9%. Tree nuts have a prevalence of 0.4% to 0.5% in the United States and 0.03% to 8.5% in France, Germany, Israel, Sweden, and the United Kingdom. About 70 to 80% of children with an egg allergy will outgrow it, and about 20% of kids will outgrow peanut allergies. The amount of hospitalizations or emergency department visits for anaphylaxis ranges from 1 in every 100,000 people in the population to as high as 70 out of every 100,000. Food intolerances take place solely in the body's digestive system. They do not involve the immune system. An intolerance to food can occur when our bodies lack specific proteins needed to break down certain foods. They can also occur when a food component causes irritation within the digestive system. The most commonly known food intolerance is lactose intolerance. This condition is caused by a lack of lactase, a protein needed to digest the milk sugar lactose. Gluten is another common intolerance, and it is related to several medical conditions, including celiac disease. Other intolerances include caffeine, aspartame, which is an artificial sweetener, egg, MSG, which is a flavor-enhancing additive in foods, salicylates, which are natural chemicals produced by plants to protect them from environmental stressors, food coloring, amines, which are produced by bacteria during food storage and fermentation, yeast, FODMAPs, which is an abbreviation that stands for fermentable oligo, di, and monosaccharides, and polyols. They are a group of short-chain carbohydrates found naturally in many foods that can cause digestive distress. Sugar alcohols, sulfites, which are preservatives found in foods and medication, and fructose, which is a type of FODMAP that is a simple sugar found in fruits and veggies and sweeteners. Symptoms for food intolerances include headaches, nausea, stomach pain, diarrhea, vomiting, bloating, rashes, fatigue, runny nose, and reflux. Food intolerance diagnosis must be diagnosed by a medical professional, physician, or allergist. If a physician thinks that you have an intolerance, they may suggest additional medical tests.
Some causes of food intolerances include the absence of an enzyme needed to fully digest the food. An example of that is lactose intolerance, which is a pretty common thing that people have heard of, and so in that you don't have the lactase enzyme that digest the lactose. Another cause is irritable bowel syndrome, which is often abbreviated as IBS. This is a chronic condition that causes cramping, constipation, and diarrhea. Sensitivity to food additives, for example, sulfites, which are used in dried fruit, canned goods, and wine, can trigger asthma attacks in sensitive people, causing you to be intolerant to that food because you are not able to consume it. without having that attack. Recurring stress or psychological factors. This is not really known why this can cause food intolerances, but sometimes the mere thought of a certain food can make you sick. So more research needs to be done on that. Celiac disease, which is an intolerance to gluten. And then food intolerances are commonly diagnosed by elimination diets, which are specifically designed to narrow down the food you think you're intolerant to, but they can also be identified through other testing methods, which we'll talk about a little bit later. Elimination diets are designed so that you remove the food that you believe you have an intolerance to until you no longer have symptoms, and then the food is reintroduced. And if there are multiple, one at a time, and then symptoms are monitored, and this should be done under the supervision of a doctor. Some data and statistics with food intolerances are 20% of the world's population may have a food intolerance. 65% of the world's population has trouble digesting lactose, and that prevalence varies a little bit with between ethnicities. And then 0.5 to 13% of the population have a non-celiac gluten sensitivity, which is a milder form of gluten intolerance. Understanding the difference between food allergies and food intolerances is really important. So we just have a couple quotes on here that help to understand that. So a true food allergy causes an immune system reaction that affects numerous organs in the body. And then food intolerance symptoms are generally less serious and often limited to digestive problems. And then this third quote kind of just wraps it all up. But food intolerance is a chemical reaction that some people have after eating or drinking some foods. It is not an immune response. So that is the biggest thing that we want to emphasize here, is that a food intolerance is a chemical response within the body, whereas a food allergy is an immune response within the body. And then this last quote, finally, because patients frequently confuse non-allergic food reactions such as food intolerance with food allergies, there is an unfounded belief among the public that food allergy prevalence is higher than it truly is. So understanding this difference is important, because otherwise a lot of people do not understand it and then get confused when they are talking about allergies versus intolerances. So now we're going to detail a couple different allergic conditions. The first one I'm going to talk about is probably the most well-known, and it is food-induced anaphylaxis. And this is a serious allergic reaction that is rapid in onset and may cause death, usually occurring right after eating the food. Another common one is GI food allergies. This includes a spectrum of disorders that result from adverse immunologic responses to dietary antigens. One is immediate GI hypersensitivity. This is when upper GI symptoms occur within minutes, and then lower GI symptoms may occur within minutes or may have a delay of up to several hours, and it is commonly seen as a manifestation of anaphylaxis. Eosinophilic esophagitis, abbreviated as EOE, is a localized eosinophilic inflammation of the esophagus and is associated with the presence of food-specific IgE. Eosinophilic gastroenteritis is a constellation of symptoms that vary depending on the portion of the GI tract that is affected and involved with this, and it is a pathologic infiltration of the GI tract by eosinophils, and it is also and then EOE is a common manifestation of EG. Food protein-induced allergic proctocolitis is in infants who are seen as healthy but have visible specks or streaks of blood mixed in with the mucus in their stool. And then food protein-induced enterocolitis syndrome, which also commonly occurs with infants and manifests as chronic emesis, diarrhea, and a failure to thrive. The last one is oral allergy syndrome, which is a localized IgE-mediated allergy, which usually has to do with raw fruits or vegetables, but these symptoms are purely confined to the lips, mouth, and throat, and it most commonly affects people who also have pollen allergies.
Cutaneous reactions to foods are some of the most common and include IgE-mediated, cell-mediated, and mixed IgE and cell-mediated. Acute urticaria lesions develop rapidly after ingesting the problem food and appear as polymorphic, ground, or irregular shaped pruritic wheals. Angioedema most often occurs in combination with urticaria. It is characterized by non-pitting, non-pruritic, well-defined edematous swelling that involves subcutaneous tissues, abdominal organs, or the upper airway. Atopic dermatitis is complex interactions between skin barrier dysfunction and environmental factors such as irritants, microbes, and allergens. Allergic contact dermatitis, or ACD, is a form of eczema caused by a cell-mediated allergic reaction to chemical haptens that are additives to foods or occur naturally in foods. Contact urticaria can be either immunologic or non-immunologic.
Allergic conditions. Respiratory manifestations occur frequently during systematic allergic reactions and are an important indicator of severe anaphylaxis. Heiner syndrome is a rare disease in infants and young children caused by indigestion of milk. Symptoms include pulmonary infiltrates, upper respiratory symptoms, GI symptoms, failure to thrive, and iron deficiencies, anemia.
Diagnostic tests are used to be able to determine if a patient has allergies or to find out what a patient is allergic to. Allergists use the following tests based on their medical history. The skin prick or puncture test is the most commonly used test to evaluate a patient with food allergies. A small drop of each allergen will be placed on the skin, and the nurse will lightly prick the surface of the skin under each drop so a small amount of the allergen will seep into the skin. Sometimes the nurse or doctor will do multiple tests, like the picture on the slide. A positive skin prick test result suggests the presence of food-specific immunoglobulin E present on the surface of cutaneous mast cells. Usually, the size of the response correlates with the extent of clinically reactive to the particular food. In a patient with confirmed food allergy, the skin prick test helps in identifying the foods responsible for immunoglobulin E-mediated food allergies. The allergen-specific serum immunoglobulin E aims at detecting the presence of specific immunoglobulin E antibodies in the serum, which represents allergic sensitization rather than clinical reactivity. Thus, high levels of specific immunoglobulin E may suggest ingestion of the food in question will lead to an allergic reaction. The atopy patch test is generally used when history is suggestive of delayed or non-immunoglobulin E-mediated mechanisms for the reaction. The use of skin prick test, specific immunoglobulin E test, and atopy patch test in combination may provide higher positive and negative predictive values but may not be clinically relevant. Moreover, this may be time-consuming for the patient and families and thus inconvenient. However, using two tests may sometimes be more helpful for identifying the culprit food allergens. The food elimination diets in some patients can lead to omitting one or more foods as suggested by their medical history and may be useful in diagnosing of food allergies. However, this can result in nutritional deficiencies, especially when multiple foods are omitted from the diet. The oral food challenges is the gold standard for diagnosing food allergies. An oral food challenge should begin with the patient consuming a dose that is lower than the dose required to elicit a reaction. The dose is gradually increased during the challenge while monitoring for any allergic symptoms until target dose is reached. The food challenge is negative if the patient does not develop any symptoms, and this helps to rule out food allergies. A definite diagnosis of food allergies can be made when the challenge is positive or the patient develops objective symptoms during the challenge and results correlate with medical history and laboratory tests. Finally, the molecular or component-resolved diagnostic tests aim at identifying immunoglobulin E against specific proteins in a food and can provide more specific diagnostic information. Patients who are allergic to milk, egg, soy, and wheat can be tested annually, whereas patients who are allergic to peanut, tree nut, fish, and shellfish can be evaluated every 2 to 3 years. However, in the event of a recent food allergy reaction, repeat testing can be deferred for several years. Treatments and interventions. Despite the risk of severe allergic reactions and even death, there is no current treatment for food allergies. The disease can only be treated by allergen avoidance or treatment of symptoms. The symptoms treatments can include the use of antihistamines, steroids, and decongestants. For intolerances, there are some medications available that a patient can take before eating the food that can limit the symptoms that they normally would experience. For example, someone with a lactose intolerance can take the lactid pill before ingesting any dairy products. EpiPens are frequently used for allergies to various foods that can turn into anaphylactic shock, such as peanut and shellfish allergies. The downside of EpiPens is that it costs around $650 to $700 for a pack of 2 pens, and the pens last only 18 months after their manufacture before the epinephrine expires.
Relevance and use for nurses. As a nurse, it is very important to understand the differences of both food intolerance and food allergies, especially when caring for a patient. Nutrition-wise, this helps the nurse to create a meal plan that is right for their patient. As a nurse, we also have to be aware of what medications our patients are allergic to, as well as similar medications that the patient may be allergic to. So we don't give them the wrong medication and cause a severe reaction. In addition, many food allergies are tied to certain vaccines. Nurses need to be aware of what vaccines contain common food allergies. Here's a couple people from the Carroll community that have either allergies or intolerances and their responses to it.
Hi, I'm Tatum Elmer. I'm a sophomore here at Carroll College, and I'm allergic to peanuts, tree nuts, avocados, mangoes, latex, and gluten, and I also have angioedema and uricardia.
I'm Clayton, and I'm allergic to tree nuts.
I'm Caitlin. I'm allergic to green peas, apples, pears, nectarines, peaches, kiwis, and melons, and then I am intolerant to wheat, dairy, sugar, red meat, fruit, and garlic.
Well, in 5th grade, I had been eating peanut butter and jelly sandwiches every day, going to school and whatnot, and then one day, my mom's not really a cook, and she cooked me some dinner and gave me some dessert after, and it was Boy Scout popcorn. And after I ate that, it was, I think the Mud Puddles or something, and it had peanuts in it. And then immediately my lips swelled up. I looked like I was Kylie Jenner, and then like I couldn't breathe. It felt like sandpaper in my throat, and my throat was closing, so we had to call the ambulance. And then for latex, funny story behind that, it was actually on my 16th birthday, and I never sucked helium out of a balloon, and I tried doing it and ended up in the hospital.
My mom made something with nuts in it when I was like 2, and then I ate them, and she took me to the hospital.
Okay, so I found out originally about my intolerances from just eliminating them from my diet with a doctor, and then later on I had an allergy test, a blood test, and then I found out about both my allergies and my intolerances through that.
Well, my reactions kind of depend on the food that I'm eating or whatnot, especially like with gluten. Since I'm celiac, I'm just intolerant to that, so it kills my stomach enzymes and I don't have an allergic reaction. But with food, I normally get blisters and it's hard for me to breathe from the blisters. My face swells up, so does my esophagus, and from that, I'm not able to breathe and whatnot.
My throat hurts, I get rashes all over my body. It really sucks. Kinda. And then I take Benadryl and aspirin and allergy pills.
Okay, the foods that I'm allergic to, if I eat them, my mouth swells up and my lips get really itchy. And then to relieve that, I usually take Benadryl. And then any of the foods that I'm intolerant to, I just get really nauseous. And then my joint pain gets bad, and I get really bad fatigue and brain fog. And then to relieve that stuff, I take histamine blockers. or antihistamines, and then also just drinking a lot of water.
So I take a thing called Pepsid, which is to help with my stomach acids. I normally get really bad acid reflux and heartburn because of my celiac disease, and if I get accidentally in contact with that, I avoid all foods that I'm allergic to, and I take a daily allergy pill as well to help with my angioedema.
I do not eat nuts.
The biggest thing I do is just take the antihistamines daily, and that helps a lot with the foods that I'm intolerant to, but otherwise I just eliminate almost all of that stuff from my diet. And then I do have like gluten and dairy like on occasion, but yeah. Okay, that was really
The last one I tried was avocados, and I had a delayed reaction to that and ended up looking like a tomato.
Okay, so my food allergies and intolerances have changed a lot. My sophomore year of high school was when I found out that I had any allergies or intolerances, and at that time I only had intolerances to wheat and dairy. And then after like 3 months of finding those out, I figured out that I was also intolerant to eggs and potatoes and garlic and onions. And then after that, I just kept getting intolerant to more and more things. And I, at that point, so at one point I could only eat 6 foods. I could only eat spinach, rice, chicken, sweet potatoes, grapes, and oranges. And that was because I later got diagnosed with leaky gut syndrome, so it was just making me intolerant to almost every single thing I ate. And so then, and I had an allergy test at that point, and those were the only foods that came up that I could eat. So then after like a year of treating my leaky gut, then my allergies changed again and are pretty much similar to what they are now. The only other thing I used to also be, like I said before, but the eggs I was still intolerant to after I treated my leaky gut, but then after another year, I got my allergies rechecked, and then that one I grew out of also. So now they're at what I stated before.
So normally after any allergic reaction that I have, they want to retest me to make sure it's not anything else if I don't know what caused the reaction, and at least every 2 years I get it redone.
The first time is when I got tested, and that's it.
I get my allergies tested by that blood test every 1 or 2 years, kind of depending on how I'm feeling.
Not gonna lie, it sucks. Everyone's always eating bread or like chicken nuggets or onion rings. I can't eat that, or they're eating like a cookie or like Reese's Pieces, and I remember what it tastes like since I wasn't allergic to it at one point and I had tasted gluten. So yeah, it kind of sucks.
Oh, it's just terrible. I really had to accept it to live with it, you know. It's just such an inconvenience, and normal people don't understand. So, that's it.
My allergies have impacted my life a lot because obviously I have a lot of them, so I just have to be a lot more cautious anytime I'm eating anything, especially in restaurants and stuff, because a lot of times I've asked if my allergies are in the foods and then they told me no, but then I would get sick from eating those foods. So I just have to be really cautious and like read food labels really well and make sure that none of my allergies are in there, and yeah, and just like be cautious.